Okay. Um, just want to take you through this case. This was a 40-year-old gentleman who came in with right-sided facial swelling, and this was actually ordered as an outpatient for facial swelling. That's all the history I had. So let me take you through the T1s. A few things to note. We're at the level of the mandible. The cortical bone and the teeth are hypointense on T1. They're hypointense on T2, and most calcification is hypointense on T1 and T2. There are some exceptions. I think notably certain microcalcifications are bright on T1. But here's the mandible, and here's the maxilla. And so you want to look, roots should be dark and bone should be dark, or at least the cortical bone. So any areas where this is not true is concerning for pathology. So I'll just jump to it. It's hard when you're not the one scrolling, but you can see this area right here. That looks like a root. It's coming from a tooth. It's just not quite as dark as the other roots here. And here you can see the cortical bone, and then it's missing. And there's some kind of intermediate signal soft tissue around the root. So let's see what that looks like after contrast, since that's what they did here. Not that they needed to. They didn't really need to get an MR at all. But let's compare T1 and T1 post-contrast with fat-sat. Let's scroll to that same level. Here we go. So here's the root again. You can compare to similar slice. Let's see. So these aren't registered perfectly. So you can see this slice over here kind of matches best with this slice over here. Let's go back to the post-contrast images. You have the root. It's near the apex. You've got enhancing tissue around the root. You have loss of cortical bone, and then you have some enhancement of the soft tissues, somewhat asymmetrically. You can see it's enhancing more than the tissues on this side. There is some incomplete fat saturation, so some of this may be incomplete fat saturation, but I think there's definite soft tissue enhancement. So this patient had an odontogenic infection with periapical periodontitis and overlying cellulitis. This is all from dental decay.